Race on your health. There's no race on health.
Like many people of color, Brian Childs felt he was not being heard when communicating with his medical provider.
When I went to the doctor, I was trying to tell the doctor that my back hurt and everything, and instantly he was like, "It sounds like you got COVID."
It's that disconnect that has led some African Americans to shy away from seeking medical treatment based on a mistrust that some say goes as far back as the 1930s, after the U.S. government conducted an unethical experiment called Tuskegee Syphilis Study on African Americans without their consent. April is National Minority Health Month, a time to increase awareness about disparities in medical care. One Southeast Michigan hospital says it has a dedicated approach that has been in place for several years to create a more equal and equitable environment for patients and staff.
We work in the hospitals to try to create awareness, educate, and advocate for our patients.
One way Beaumont is achieving that success is through its Diversity Day program, where staff learn about other cultures by seeing situations through someone else's eyes.
Simulate walking in someone else's shoes. And so when you can put yourself in someone else's shoes, you have a little bit more empathy.
As chair of the Diversity, Equity, and Inclusion Committee at Beaumont Troy, Hardin believes it's education that leads to understanding and ultimately better medical outcomes.
If we can educate our physicians on the backgrounds of our patients, again, Beaumont can then provide the best care for our patients.
Beaumont officials are also working to hire a person fully dedicated to this mission.
We are actually actively working to hire a Chief Diversity, Equity, and Inclusion Officer, and that person will be over Beaumont and Spectrum Health, and that's going to allow us the opportunities that we need to do exactly what we need to do for our patients in the community.
In Troy, Ingrid Kelly, Fox 2 News.